All right, so we are back with Danielle, and she actually did a series of self-treatments, so there was nothing involving my hand on you to improve mobility, and you now have improved posterior rotational mobility, okay? This might be a whole pelvic pattern. It may have nothing to do with your SI joint. The language is kind of makes it sound like it's all SI, and yes, there are linguistic problems. We might just call it a bilateral anterior tilt. But anyway, for our purposes, it's not to debate the language. We can see the treatment effects, and I like this work because it makes the person independent immediately. Okay? Bad business model. Lie on your stomach. So the lower part of your sacrum, I spring it and I can see your feet rotating when I do that. So the force goes through it instead of being blocked. I can inferior glide on one side of the pelvis, on the other, and the motion goes through that. Same thing through the sacrum. Superior glide, you have good mobility. Same thing on that side. Sacrotuberous ligament was really quite hard, and that now feels ligamentous. It gives. Okay, you were quite restricted up at about T3-4, and I still perceive some tightness there. We can talk about how you can treat that a little bit later. I think it's a little better I think it's a little more mobile. Your thoughts?
Less tension.
Less tension?
Mm-hmm.
Okay, so lie on your back. I'm real curious about upper cervical, and who knows if it'll help your jaw or not. Maybe if part of the jaw problem comes from the head and neck being hyperextended, maybe we will help the jaw. So I'm at C1 gliding it anteriorly, and that moves very freely now. I can traction. You can see her feet bob up and down when I traction the upper cervical. So that's much more mobile. I can spring the occiput, side bend occiput, side glide C1. So do you want to open your jaw a couple of times?
Now.
Can you give us some feedback? And speak loudly, please.
Mm-hmm. Yeah, the popping is not as intense, where it used to just be so loud and just so hard. Now it's minimal. It's not as painful either. I open it all the way.
So in 10 minutes of you self-treating the mobility in the lumbopelvic region, you feel like your jaw is improved?
Mm-hmm. Yes.
Good. Could you walk around and give us some more feedback?
I don't feel like I'm dragging my leg anymore from being so long on the right side.
It's interesting because you're the second person to say that you had a unilateral asymmetry. Sertina had a unilateral something going on with your knee. You felt like you had to hyperextend your right knee. You feel like you dragged your right leg. I have no explanation, because what we treated was a symmetrical pattern in the pelvis. So it's, the body, this is what the body does, so who am I to say what the body can or can't do? Any other comments you have?
There's just not as much tension here, because I always used to feel like something would land here, and then this leg would dragging.
So you have less stiffness in the right lumbopelvic SI area?
Mm-hmm.
Very good.
Yeah.
Anything else?
Just doesn't feel as tight up here anymore.
Test your neck rotation.
Yeah, it doesn't feel like anything pulls when I do this now.
So it'd be fun to see how you respond when you're driving your car now. Because I think,
I'm sure the public will be very happy.
Yeah, safer. The world will be safer.
Yeah.
So if you see lots of bodies in the road, find out who the driver was and improve their lumbopelvic mobility, correct?
Mm-hmm.
So that reflexively they can turn their upper neck and they'll have better lateral vision, right?
I think I need to make my chair higher too, because I notice when I sit, I sit like this to look over the steering wheel.
Good,
so
good.
I probably should raise that.
Yes, yes. Alrighty, so we'll stop filming now, and please give us